All right, well, good evening, everyone, and welcome to our Patient Healthcare Forum. My name is Dr. Sharad, and I'm a family physician and president of the London and District Academy of Medicine, which is a branch society of the Ontario Medical Association. The London and District Academy of Medicine has been around since 1919, and its function is to foster professional harmony and social harmony, to advance knowledge in medicine, to promote healthcare in the community, and to assume the duties of a branch society of the Ontario Medical Association for the City of London and the County of Middlesex. On behalf of the executive of the London and District Academy of Medicine, I would like to thank all of you for coming out tonight to hear our patient stories. Events of this nature are important for informing not only our elected leadership, but the public at large about the everyday struggles that Ontarians are experiencing in our healthcare system. Tonight, you will hear about patients experiencing delays in surgical wait times for hip, knee, and back surgery, delays in receiving imaging, and delays in referrals to specialists. These experiences are unquestionably a consequence of chronic underfunding of the healthcare system. We need our elected officials to hear these stories and address this issue. To that end, invitations for this forum were sent out to elected officials in the Ontario Legislature, including Deb Matthews, Liberal, Jeff Urich, Progressive Conservative Party, and Teresa Armstrong, and Peggy Sattler from the New Democratic Party. I'd like to expend a special thanks to Teresa Armstrong and Jeff Urich and Peggy Sattler. She told me she'd be here tonight, so hopefully she's going to join us in a few minutes. I'd like to expend a special thank you to all of them for attending our forum tonight. Unfortunately, although an invitation was mailed out to Deb Matthews and phone calls were placed to try to secure her attendance, we did not hear back from her office regarding whether she would be able to attend our forum today. Tonight's forum is about putting patients first and giving them an opportunity to share their stories of the difficulties that they have experienced regarding timely access to healthcare, difficulty navigating the healthcare system, or adverse consequences as a result of a lack of timely access to healthcare. It takes a lot to discuss these issues in an open forum, and I'm very grateful to all of our patient panelists for sharing their stories today. We don't propose to solve all of our healthcare systems issues with this forum alone, but to raise broader awareness about what our patients are experiencing with the healthcare system as it stands today. Now, I'd like to take a few minutes to introduce our moderator, Mr. George Clark, who is seated to my right. Mr. Clark is an accomplished reporter, currently working as a freelance columnist with the London Free Press. He graduated from the University of Western Ontario with a BA in 1966, attended UWO's School of Business and Marketing Management program in 1988, and has held a variety of prominent positions with various media outlets over the years. He started as a reporter, producer, and anchor for CFPL TV, CFPL TV News from 1967 to 1979, held the position of adjunct professor in journalism at the UWO Graduate School of Journalism from 1976 to 1980, and he has worked in various capacities as managing editor, assistant news director, and news director with CFPL TV News, CKNX TV News in Wingham, and CHWI TV News in Windsor. He was also the news talk host for AM 980's Focus 980 program from 2003 to 2005, was the host of Politically Speaking on Rogers Television from 2004 to 2008, and the news director anchor of First Local News for Rogers Television London from 2004 to 2009. He has also shared with me that he is a voracious reader and has a library of over 7,000 books at his home. I'd like to extend a special thank you to Mr. Clark for coming out tonight and hosting our forum. Your public service is greatly appreciated. I'd like to close with a few comments about the format for this evening's Patient Healthcare Forum. Our purpose, again, is to put our patients' stories first and provide them a safe environment for sharing those stories. We anticipate that our audience will have questions. To that end, we are respectfully requesting that all questions be directed to our panel of patients who are seated to your left, and that you write down your questions on the cue cards that were provided to you at the entrance this evening. Each speaker from the panel will have 5 minutes each to share their stories. If you have a question while they're speaking that you'd like to share with the panel, please write it down on the cue card, raise your hand, and someone will come around to collect your card. Mr. Clark and myself will review the questions and pose them to the panel once our speakers have finished. Again, I would like to thank all of our patients for sharing their stories, our audience for coming out and being a witness to those stories, and our MPPs for hearing those stories, and last but not least, our executive assistant, Ms. Lynn Pritting, who is somewhere back there. Lynn, wave. Okay. Lynn, thank you for her invaluable assistance with managing the logistics of the event. Lynn, we just couldn't do without you. Now, without further ado, I'd like to invite Mr. Clark to take charge of our Patient Healthcare Forum. Thank you.